Now, more than ever, it matters where you get your news. Newsradio 1080 KRLD.
Just yesterday, Dallas Mayor Eric Johnson announced he is now requiring local hospitals and healthcare facilities to submit daily updates on their resources, including the number of hospital beds available. Dr. Katie Jarvis is a local physician. She is also the CEO of Dallas-based Bed Beacon, a company that is looking to simplify that process. Dr. Jarvis, it sounds like this whole thing can get pretty complicated.
It looks like Governor Abbott also issued an order stating that he wanted daily reports sent up to the state as well. So I think that this response is a response from our city about how are we going to do that. And so the city is going to be fielding emails from 100 hospitals or 90 hospitals and from 250 nursing homes every single day, and then reporting that up to the state. So they're certainly going to be working around the clock to gather this information and also to then report it and respond to it.
Now, this is your business. This is your line of work. You help to organize information. How much easier does what you do make this monumental task in the city of Dallas?
Okay, so as you know, we have a software platform that will allow for hospitals and nursing homes to communicate as patients are moving from one type of facility to another, risk of COVID-19. But we've also built into our platform the ability for all hospitals to report the number of ICU beds they have, the number of ICU beds they have occupied, and then also the number of ventilators they have available and occupied, and their number of beds that are taken and occupied. What this means is that we could provide one single daily report to the city of Dallas to show them all of the hospitals that are occupied and not occupied as far as their beds, their ICU beds, and their ventilators. This could actually be updated real time throughout the day so that the city could have the most up-to-date information in their reports, and then they wouldn't have to check their email hundreds of times a day in order to compile the report. So we can make that reporting simpler for the city because we know that they're responding to so much already.
Are most of these facilities going to be compiling this information manually, which sounds like a heck of a lot of work?
That's correct. So they're going to be compiling it manually and then sending an email daily to the city and then to the state. And so we can simplify that reporting quite significantly.
That is local doctor and Bed Beacon CEO Katie Jarvis.